My third current event was fat shaming in the doctor's office can be mentally and physically harmful. And this was kind of a discussion on the American Psychological Association's stance on the fat shaming seen in doctor's offices. The author, who was unnamed, uh, he or she discussed the effects of medical discrimination based on people's size on overweight individuals' mental and physical well being. And the author stated that recently fat shaming and disrespectful treatment have been used to try and motivate overweight people to change their eating and exercise habits. Um, I think doctors thought maybe if the individuals wanted to see change because they kind of felt bad about themselves, that would really motivate them to lose the weight. But instead of motivation, these patients actually started to delay seeking health care for possible serious medical conditions, and they avoided interacting with providers because they figured that, well, I have these symptoms, but it's because of my weight. It's because I'm overweight. If I lose the weight, I'll be fine, even though it may be an underlying different illness. Um, Medical providers may not take overweight patients' concerns seriously and fail to run the proper tests, and this would result in a misdiagnosis, which could potentially which could be fatal for the patient, which would be terrible. And then one study actually of 300 autopsy reports showed that obese patients were 1.65% more likely than individuals of a healthy weight to have significant undiagnosed medical conditions, and this could include endocarditis and lung carcinoma. Um, Fat shaming, you can also see that not just in doctors' offices, but also in social media is really big. Um, but the evidence that they showed in the article proved that fat shaming is not the way to motivate people to lose weight, but instead it causes high levels of stress and anxiety in overweight individuals. And he ends with a quote saying that treatments should focus on mental and physical health as the desired outcome for therapy and not on weight. So instead of saying lose weight, instead you should want the individual to be healthy and the individual to make sure that they're mentally and physically healthy.